Hi, it's Tom here from Running Physio. Today I want to talk to you a little bit about the psychological impact that running injury can have. Now, I think if you know runners and you work with runners, and perhaps if you're a runner yourself, you'll recognize that we run for lots and lots of reasons. And for many of us, we actually run for our mental well-being as much as our physical well-being. So we can find then if we're unable to run, not only do we lose physical fitness, but it has an impact on our mental health as well. And I find through experience when you're working with runners, you know those ones that perhaps feel quite intense to work with, that are messaging you regularly, that have lots of questions, lots of concerns. It's often because they're running for their mental well-being and they're really feeling the effects of not being able to run. So I want to explore this a little bit in this video and draw on some interesting new research which I think will be useful with working with people in clinic. So first thing then to consider in terms of the psychological impact is people may be losing that coping mechanism of running. So it may be having a knock-on effect on their mood. If they're using running for managing depression, stress or anxiety, they may be experiencing more symptoms of those conditions, and as a result that's going to increase their distress and it may increase their worry about the injury itself. Running is often a great form of social life for people as well, so they may be losing out on the social side of their sport, which also is going to have a potential psychological impact on them as well. Now you can lessen that by talking to them about remaining within the social context of their sport, so they can still go along to social events, they might be able to attend track sessions and things and help out even if they're not able to run at the moment. So I'd very much try and keep people involved in the social side of their sport, particularly if they're out of with an injury for a long period of time. And if they're very much relying on running as their sole coping strategy for their mental well-being, this can be an opportunity for them to learn some other strategies, because we know most of us runners, best will in the world, we are going to pick up injuries, particularly as we push ourselves towards events. And if we rely solely on running as a coping mechanism, when that happens, we're really going to struggle with our mental well-being. So perhaps it can be an opportunity for them to find a really good counsellor to work with, perhaps to help them improve their mental well-being and their understanding of their mental health. Perhaps they can look for other strategies, things like meditation, looking at work-life balance, looking at lifestyle factors like sleep, like alcohol consumption, etc. So this can be an opportunity for people to actually develop better coping strategies for their mood and mental health. And I think really from our point of view as a clinician, we really want to try and identify if someone's struggling and empathize with the situation they're in. One of my biggest bugbears working with people that have perhaps not had a great experience receiving treatment elsewhere is they're often told, well, just stop running. You know, you've got pain when you run, so just stop running. But actually, this doesn't see the impact that not running has on them as a person and their mental and physical well-being. So we can very much connect with runners about this, recognize the impact and help them to lessen it and manage it. Now, I wanted to talk to you in this video about some new research just published by Ben Maschke, who actually is a clinician who's delved into the research side of things. And I think there's some interesting findings that you'll find useful to apply in clinic. So what Ben's research that's just been published in Physical Therapy and Sport did is they took a group of 43 runners with injury. And they looked at 3 different questionnaires at baseline and then repeated them again 12 to 16 weeks later. Now, these 3 questionnaires, one was this one, the University of Wisconsin Running Injury and Recovery Index. The second one was an athlete fear-avoidance questionnaire. And thirdly, the OSPRO YF, which is a screening form for yellow flags, essentially. Now, I'm just going to stay with this first questionnaire that they used, because one of the things I took from this really interesting study was just how useful this questionnaire is for our runners with injury. Not just from a psychological point of view, but actually there's a lot here that I think we can use to inform our treatment. So if we look at some of the questions that we've got here, I think they can actually be really handy for us to look at the impact that running injury is going to have and how we can address it. So number one, how does your running injury impact your ability to perform daily activities? And this is really useful for looking at irritability. Because if you've got someone who's having a lot of pain with day-to-day activities, they're often not able to tolerate much running. So that's a really useful question for us. If there's no impact or slight impact on day-to-day activities, it's usually a better indication that they'll tolerate continuing to run. Question 2 is more looking at the impact of the injury itself. So how frustrated are you by your running injury? Question 3, how much recovery have you made for your running injury? This is about perceived recovery, which is good, so you can see where they feel they are. How much pain do you experience while running? Question 4, really important, useful question for us again, because pain during running can indicate their tolerance of that running. And then question 5, how much pain do you experience during the 24 hours following a run? Now these two questions, 4 and 5, are so useful for you to adapt someone's running. Ideally here we want them to have minimal pain during the run for question 4, and ideally no pain or minimal pain for 24 hours afterwards. And probably question 5 is a more useful one here. If they're getting significant pain for 24 hours plus after a run, it's a sign that they're not really tolerating it. Question 6, how has your weekly mileage or weekly running time changed as a result of your injury? Here we're looking at the impact running is having on their training volume. Brilliant. Question 7, how has the distance of your longest weekly run changed as a result of your injury? Again, a really useful question because it's going to link back to their goals. For example, in marathon season, we know runners need to be building up long runs to typically 18, maybe 20, 22 miles as a peak before they run their marathon. This is giving you an indication of whether they're tolerating those long runs. Question 8, how has your running pace or speed changed as a result of your injury? Now, some runners will find they can tolerate the distance, but they can't manage the pace. If that's the case, this might lean me towards wanting to include some power and plyometric rehab to help them with actually tolerating those faster runs. And then question 9, how does your injury affect your confidence to increase the duration or intensity of your running? So how confident do they feel in their ability to change their training? And this is important as well, because if we want to get them back to their specific training goal, we need them to be confident in increasing their training. So this, I think, is a really useful questionnaire and something that I would take from the study, something I think I'll be using in clinic with runners to see. You get a score there. 36 would be the best possible score back to kind of pre-injury level, and 0 would be the worst score, essentially meaning unable to run. So let's come back to what this study found. And so we've got these 43 runners. They've done these questionnaires at baseline and then 12 to 16 weeks later. What did this study find? Well, they found the results from this University of Wisconsin index correlated with the athlete fear-avoidance questionnaire results at baseline, which is quite interesting. But they didn't correlate with the yellow flag screening tool at baseline. They also found that the results from this University of Wisconsin index improved over time, but the scores from the athlete fear avoidance questionnaire didn't tend to improve over time. Now, what this seems to suggest then is that runners are able to improve their running over time, but maybe some of those fear avoidance beliefs actually stay with them and aren't addressed. And this is then reflected in the conclusion from Maschke et al. So they say, injury-related psychological distress is elevated when injured runners start rehabilitation and generally improves. However, negative mood and athletic fear avoidance may persist. So, some interesting findings from this research. And the question is, well, what can we learn from it? What are the take-home points from this and from this video? So firstly, one, there is evidence that runners do experience psychological distress at the start of an injury. And this is something we want to recognize and try and help them with. It does appear that their ability to run, their perception of their ability to run does improve over time. But interestingly enough, they weren't within 12 to 16 weeks, generally getting back to their pre-injury level, which might give us some thought about realistic timeframes. If in 3 to 4 months, the majority of these runners weren't back to where they were pre-injury, I think we have to consider the realistic timeframes for a lot of runners we see. They're not all going to get back to where they want to be in 3 to 4 months, particularly because if you've had to reduce your training during injury, it takes time to get back to where you want to be. Point 3, we know that some runners do need to run for their mental health and well-being, and we need to recognize that and help them find alternative coping strategies and also seek appropriate help if they're really struggling. Point 4 is that this fear avoidance may persist after injury, even with people building up their running, and it seems to be important for physical function, and it may be part of the reason why a lot of these runners were not actually back to their pre-injury level. Now, if we think in other research, think of things like Claire Ardern's research in coming back after ACL reconstruction, we see that fear of re-injury can be a significant barrier for return to sport, and it might be that that's part of these fear avoidance beliefs. So really, point 5 here is we need to assess and address these fear avoidance beliefs as early as we can in the rehab process. So you might use something like this athlete fear avoidance questionnaire perhaps, or talk to them about their attitudes around injury, because they might form a barrier preventing people to get back to where they want to be. And we also see in a number of different pathologies, tendinopathy, patellofemoral pain, for example, fear, kinesiophobia, fear of movement seems to be really correlated with outcomes. So I think really with our runners, try and assess and address this in the early part of our rehab. And the final take-home point 6 is be prepared to ask runners about their mood and mental well-being at the start of their injury. See if it is something they need help with, because not every runner will feel confident to tell you about that. And if they are struggling, we want to get them the support to lessen the psychological impact of injury, and as I've said, to help them develop other coping strategies. Okay, so I'd love to hear from you on this. I'm sure lots of you treat runners, perhaps are runners yourself, and will have come across some of the psychological impacts that running injury can have and how it impacts our mood and mental well-being. So let us know in the comments and replies. I've put a link there to a selection of different running injury videos that we have on things like tendinopathy, lower back pain, lateral hip pain, etc. And you'll see generally our approach is to consider the person central to the injury here, rather than just thinking about the bit that hurts. So if you'd like to learn a little bit more about running injury, do check out those videos. I've put a link to that. And in the comments to this video, I'll also include the links to the research from Ben Maschke, and also the links to the research on the University of Wisconsin Running Index. Okay, thanks again very much for listening. If you've enjoyed the video, do like it and share it. We want it to be helpful and get this new research out there. And I'll look forward to speaking to you again very soon. Bye for now.